Today, we're going to talk about why this matters. When we look at these two dogs, I'm specifically looking at their knees. So you ask, why do I care? Well, the reason you should care is because this can lead to common issues in your dog's knees. And also down the road, with larger dogs, it can lead to issues in the back and the front legs. So let's dive into why this happens and what you can do to prevent it. So let's talk about why this matters to your dog. When we look at Ben, we can see there's a little bit of angulation in the legs. So we have at the hip joint here, we've got the leg comes down, so there's a nice angle and an angle this way. And you can see here when Sam's standing here, and I'm going to admit to you that I do have some concerns, and some of the exercises I'm going to show you today will give me a little peace of mind down the road. But if we look at his hip joint and the straightness, he hasn't quite got the same angle that Ben has. So when we look at these two dogs here, you can see how straight the leg is. Now, let's talk a little bit about how that works mechanically. So if we look at this knee here, and we look at the, sit down. Puppies learning how to be demo dogs. So when I look at this knee here, this has some angulation. And what is a concern to me is how the dog uses the knee. So the knee has a natural bend, which helps to cushion when the dog is running, especially at high velocities and doing explosive movements repetitively. And what this can lead to down the road is a torn cruciate ligament and TPLO surgery. But with the little dogs and the straight legs, as any of you that have a little dog probably have heard of a luxating patella. And basically what happens is this patella sits in a groove and it slides. So when the dog is moving and bending, this patella sits in this little groove. Now with the little dogs and that straight up and down, what happens is it can luxate. So usually it luxates medially, so towards their body, and it can slip out. In some cases, it will stay out. When they're younger, it may just slip a little bit and go back in. And as they age, the ligaments holding it in place get weaker, and then it can gradually turn into more of a situation where you may have to have surgery. But also, what happens is when they're moving, and I mentioned explosive movements, if you have a large dog or even a little dog that's just doing walks and trails and that kind of thing, probably not going to be a huge issue. Where the issue comes is when your dog does repetitive movements. And I do have a video here that explains exactly why this happened. But the Reader's Digest version is we have a straight knee, the dog is running, and we're not getting that nice bend in the knee to cushion the ground forces through the knee. And then we get the dog stopping on a dime and turning consistently. And again, because we've got that straight knee, we're not developing the quadriceps muscles, so your thigh muscles, or for that matter, you're not developing other muscles in the knee joint. And then they stop on a dime and they turn, and we get that rotational movement and nothing to support it. So over time, that's how we can tear a cruciate ligament, or in little dogs, the luxating patella, as I mentioned. So some of the other things we want to think about is down the road. So if we look at that large dog and we look at his top line, so in that large dog, what's happening is we've got his head up here and we've got this back end is higher than the midpoint of his spine. And so we think about, and the reason why his top line is like that is because the knees are straight, he has no other option but for his back to arch. And down the road, what we can get, especially in this mid-back area, is degeneration. And of course, some of this is genetic, but we want to think about how we can support all the different factors. So let's talk about exercises that can address this. First of all, we want to think about strengthening the quads, strengthening the calf muscles, along with the glutes. Here's my trusted duo to come and help me. So the first exercise that is really great for this is backing up. You're going to have your dog standing, and the key here is holding your treat at head level, not too high, otherwise your dog will sit. And what you're going to do is let them lick the treat and walk towards them. And you can see here what happens is he's bending his knees to do that. They can't go backwards with straight, well, they can, but not easily go backwards with straight knees. So again, I take the treat, go back into him, walk into him. If your dog starts to curl around, it's probably because you're moving the treat. So just make sure you keep it nice and at head height. Now, if you have a grabby dog, I have a grabby dog, or an older dog, use a Kong. Protect your fingers. The second exercise is a little bit more challenging. It may take a little bit of time to get your dog to understand what you want, but you're going to get your dog to back up onto a little platform. So if you have a little dog, use something about an inch or two. If you have a big giant dog, you may want to use something. This is like 2 inches deep. And I have just put some rubberized stuff on it so their paws don't slip. And what you're going to do is you're going to do the same thing. And you're going to have your dog walk towards or back up towards that little platform. Now, a little tip here, if you can see, he's trying to avoid it. So sometimes what is better is to put something on this side of it and on this side of it, so they're encouraged, or a box. You can use a box, you can use anything. And what you're going to do is get them to back up onto, and you can use your hand to help them. One of the things, if you can see, he's stepping over it. And the reason I'm using him is because he doesn't know how to do this. So I wanted you to see what will probably happen with your dog. So it's easier if you use something big so they can't miss it. So your dog is going to be successful. And what you're going to do, and I'm going to stand this way just to encourage him to back up onto it. Good. Good. And so you can see, you can do a little sit to stand if that works. But what happens is he has to bend his legs because his front is lower than his back. Now, if you want to see the finished product, perch, perch, there you go. And if you want to get really, really fancy, you can just use the treat, get him to go back and forth a little bit, not far, just enough so that he's actually engaging all those muscles. He's working the glutes. You can't see it, but all these muscles are twitching. He's out of shape, apparently. Good boy. So that's the end product. It does take time to shape, but it's actually a great exercise to do in the colder months when you're stuck inside and getting them something to do to activate their brain.